We're now joined by the Director of Communication Services for the Eastern Cape Health Department, Siyanda Manana. Siyanda, good evening. Thank you so much for your time. Really do appreciate it. Patient privacy is critically important. In fact, medical professionals take an oath to respect patient privacy when issuing medications or even in consulting a patient. This is clearly not being respected at the NU2 clinic. What is the department going to be doing about that?
Oliver, good evening, and good evening to all the viewers. We are very disappointed, Oliver, to learn of such unbecoming behavior by our staff. We take those allegations very seriously. What the department is going to do is we are going to send our team, which is your customer care team, to visit the clinic, so that we can impress upon the staff of the clinic, so that they can uphold the rights of privacy of each and every patient that goes to that facility. So what we are going to do then, because we have the ethics and the ethos of respecting those those rights. So we are going to engage with the staff, everybody in that clinic. So we are very, very disappointed, but we take it very seriously, and we are going to engage with them, and then we are going to engage with the clinic committee, because they represent the community of that clinic.
Yeah. Over 200 patients visit the clinic daily, but the clinic is only attending to 35 patients per day, which means that 165 patients just have to go back home, which is more than 3 times the amount of patients that had arrived at the clinic. Is 35 the complete capacity that the clinic has to attend per day, or is the clinic under-supported, understaffed, and under-resourced? And is there a plan to address that?
Unfortunately, Oliver, that is something that for us is not, it's unacceptable. We don't believe, unfortunately, that because we have about 6 nurses, and 1 nurse, according to the norm, must see about 35 patients. So it means then, if that allegation is real, it means that those patients are only seen by 1 nurse. We have 6 nurses in that institution. So 1 nurse is supposed to see 35. So on a normal day, if it is fully staffed, then we have about 210 patients that must be seen in that facility. So I don't want to say...
Sorry, Siyanda, I just want to pause you there. I want us to do some math here quickly. You say that each nurse must see about 35 patients per day per nurse. And if all 6 of them see it, that's 35 times 6, which takes you to what, 180 about patients that need to be, almost 210 really, that need to be seen per day. But that means that without considering that a nurse has a 1-hour lunch break, in a 10-hour day shift, a nurse will only have about 15 to 20 minutes per patient. Is that sufficient?
Yes, Oliver, you can even stretch it to about, let's say, 30 minutes for quality consultation. So those numbers, that have been mentioned there should be sufficient to be attended to by the available staff in that institution.
Yeah, and are all 6 nurses on shift every day?
Sometimes you find that some go on leave, but you don't find that clinic not manned by not less than 4 nurses. So, that number really does get, covered, So what we are doing, Oliver, as well, is that we're looking at the registration of the medication, because that community is one of the fastest growing communities in Motherwell. if you look at the Motherwell area, it's actually pushing, back towards the Ado area, and on the other side, it's going towards the Dosi area or the Unique area. So it's growing very, very fast. It's one of the areas that is receiving in terms of population. So it's really a pressure point for us, and that really does put pressure on the personnel that we have in Gqeberha.
Yeah. And so what is going to be done, by the way, about medication shortages? Because patients are also reporting not receiving their medication, particularly chronic medication.
When we look at, we've got a system where we can then monitor the medication in each and every facility throughout the Eastern Cape. With that NU12 clinic included. So we have not had any reports really of shortage of medication in NU2 clinic. So that also requires, further engagement with the staff there, because if then patients are saying they don't have medication, then what we need to do is then to go and check what really is the problem. Is the problem with the staff that don't order the medication, or what? But when we look at the staff, sorry, not the staff, but when we look at the medication at the depot, there is no shortage whatsoever in terms of medication. So we really need to drill and dig deeper to find out if that allegation is true. But from our side, we have not received any reports to suggest that there is really shortage in terms of medication. So that requires really, for us to go and look deeper into that clinic.
Okay, so there's a number of things that you've already committed to that the department will go in and look at. The things around privacy, the things around nurses not being able to see enough patients per day, and now the medication issue. What is the turnaround time that the community can expect from the department to address these issues?
Look, it's going to be really immediate, Oliver, because when you look at the people that are going to be doing these things, it's the very same staff, and they're going to actually be monitored by the acting district manager who's there, and the district manager. So you are going to have those people there. You are going to have your quality assurance team. They are based in Nelson Mandela. So the turnaround time is going to be very quick to be able to, establish really, the veracity of the allegations that have been made.
Yeah, we're going to have to leave it there. Siyanda Manana, thank you so much for your time. Really do appreciate it. Siyanda Manana is the Director of Communication Services for the Eastern Cape Health Department, coming to us on that protest that took place there.